The self-care project is very different from the other projects that we have implemented before, in the sense that it is client-centered. The focus is on the patient or the mother or the girl. That being the case, the women actually feel valued. When you give them information that gives them confidence to take care of themselves. The results have been resounding. It's really amazing.
Initiatives such as the self-care programs implemented through the Bayer White Ribbon Alliance partnership is a cost-effective solution for maternal, newborn and child health for all.
Self-care is the foundation of all healthcare. It empowers citizens with knowledge, skills and self-confidence to proactively control and maintain their own health and the health of their families. But in order to transform health for women and girls, we should be talking about a fundamental change in how we think about healthcare, both how we as individuals approach our own health and well-being, and how government, industry and civil society together work to change the structure of healthcare systems around the world, as well as supporting the necessary funding and policy changes.
All of these programs are focused on saving lives by addressing the most urgent needs in the community, as identified by the community. We know one of the biggest barriers to women and children receiving quality care is about who holds the power, knowledge, and decision-making. We will not meet the health targets within the health sector alone. Self-care links health, education, gender equity, women's empowerment, and community development, which all impact economic prosperity from individuals to nations. Self-care changes the relationship between a woman and her healthcare provider.
When White Ribbon Alliance came, we thought it was an opportunity for us to be able to address the problem together and try and reduce the maternal mortality in the district, which is number 2 in the districts within the Midlands province in terms of maternal mortality.
Y en estas llegadas a las comunidades hablamos no solamente con las mujeres embarazadas, sino también con las autoridades de la comunidad y con las familias, porque básicamente el cuidado de las mujeres embarazadas, pues tenemos que ir pasando el mensaje que es una responsabilidad de la familia y de la comunidad.
That's where the cruciality of this public-private partnership is important, because you have to have access to good, high-quality reproductive, maternal, child, neonatal health services. That's when the numbers start to change.
Self-care principles are the basic teach a person to fish, but they're also transformative, as you can't take knowledge and confidence away, especially from women. Linked with smart policy, we can bring these changes to every woman and child who needs them, no matter where they live.
We are so grateful. We've not had any maternal deaths. For the last 5 months where we've been running the project.
Y el autocuidado es una estrategia que nos ayuda a poner a las mujeres en el centro de la atención. Causas estructurales que hacen que las mujeres no siempre se miren a sí mismas como las protagonistas de su historia. Entonces, es muy importante como hacer el esfuerzo para concentrar esta mirada en las mujeres como protagonistas de su propia historia.
I really hope that you'll join me today in becoming a champion for self-care. For if we are to transform healthcare for women and girls and empower the next generation to create change, then governments have to recognize self-care as a policy priority and also support health literacy.